Thanks for checking out my blog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. Every week, I'll answer your most pressing questions about the COVID-19 pandemic and provide you with the latest science and advice to help you make the right decisions for you and your family. You can send me your questions about the pandemic, the upcoming flu season, or anything related to infectious diseases to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll select a few questions each week to discuss in the vlog. Our first question comes from Jeannie from Providence, Rhode Island. She asks, is it okay to get the flu vaccine and the COVID-19 vaccine at the same time? Yes. The timing of the flu shot and the COVID vaccine, whether it's your first, second, or third dose of the COVID vaccine, is entirely up to you. The only rule is that if you get them at the same time, they should be injected at least 1 inch apart. I strongly recommend that everyone over the age of 6 months get the flu shot. It's incredibly safe. And similar to the COVID vaccine, it will decrease your risk of infection, but even more so, it will decrease your risk of severe disease and death from flu. There were an estimated 28,000 deaths from flu in the 2018-2019 season, so that's really no joke. And we don't know if we'll have a light flu season like last year, or if it will come back with a vengeance like we saw with the virus RSV just this past summer. We also don't know what COVID's going to do this winter. So to prevent the possibility of overflowing hospitals, it's really important that we prevent every possible case of serious illness, of both infections. The next question comes from Bridget from Salem. Can I stop wearing masks and social distancing if I get the Pfizer booster dose? Well, that's really a question of personal risk tolerance. The fact is, a lot of people had stopped wearing masks and social distancing after their first 2 shots. And here in Massachusetts, where rates of infection and hospitalization stayed relatively low compared with other parts of the country, even in the face of the Delta wave, that's allowed. Now, Israeli data shows that the boosters decrease the risk of infection compared to being vaccinated with just 2 doses. But they don't decrease it to 0, and 0 risk is really not something we're likely to ever see. So if you hate masks and distancing, and you're willing to take some risk, and you're fully vaccinated plus the Pfizer booster shot, I definitely give you permission to ditch them, at least right now, while cases and hospitalizations are under control. And I'll let you know if and when my opinion about that changes. For the last segment, I'm going to address 2 questions at once that are about a similar topic, natural immunity. George from Chelmsford says, I'm a doctor with a patient who's requesting a COVID vaccine exemption from me if she tests positive for COVID antibodies. The patient's immunocompromised, and I told her that she's in even greater need for vaccination than the average adult. What would be your recommendation for this patient if she's found to have high antibody levels? And Charlene from Quincy asks, I was fully vaccinated with the 2-shot Pfizer vaccine and later had a COVID-19 breakthrough infection. Since often COVID-19 infections offer additional immunity, do I still need a Pfizer COVID-19 vaccine booster? Well, both of these questions surround this issue, natural immunity from previous infection. Now, some people feel like health authorities are not adequately acknowledging the existence of natural immunity. And maybe that's true. The bottom line is, if you've been infected, you have some degree of natural immunity. However, you do not want to get your immunity from infection. You're much better off getting immunity from vaccination, since infection is so unpredictable and can cause immense harm if you haven't been vaccinated. Now, antibody testing is not recommended by any experts. The CDC, the FDA, the Infectious Disease Society of America all say not to do antibody testing to determine whether someone has immunity to COVID-19. It's simply not accurate enough, and there's wide variability in the quality of the tests that are on the market. Even if you've had PCR confirmed infection in the past, some people do and some do not mount a robust immune response. But it's very clear that the vaccine definitely provides protection over and above what natural immunity provides, which is why the CDC recommends vaccination even for people who've been previously infected. If you've been double vaccinated with Pfizer and then infected, it's pretty unclear whether you would get any additional benefit from a booster. It's entirely possible that that infection served as your booster. The CDC's not addressed that particular question in its clinical guidance on their website, so I would say this is really still an area of uncertainty, and so it's up to you. It is safe to get a booster, but I wouldn't call it a necessity. We're out of time for this week. Please send your questions about COVID, flu, or any other infectious disease subject to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason for you again next week.